Margaret Shirley. I'm an American citizen living in Canada. I've been here 30 years. My family had been in the U.S. since the 1600s, and I come from a medical family. My mother was a doctor, and she ended her career actually working in the VA system. She enjoyed her medical practice there. She felt that she was able to do what she wanted to for the patients. I came here and initially did graduate work, but then went to medical school following her footsteps, and thought at one time about going back to the U.S., but I very shortly realized, when I looked at the practice there, that I would not be able to practice if I had to ask a patient if they were covered. I can only practice here in a system in which everybody is covered. I am able to practice medicine as my peers and best practice sees fit, rather than according to the dictates of an insurance company clerk who is not trained in medicine and who is primarily interested in profit. We cover everybody here. It might be a little slower, but if I need an MRI, I can't get it in my hospital, which is an hour outside of Halifax, our major city in Nova Scotia. But I can get it in 2 or 3 days downtown because I have a good referral system and people believe that my patients need them. And we have a number of specialists in my little hospital who are always ready to help me out in consultations. Nobody is left to lie in a bed without being seen. Also, the single payer system means that I can put in a bill myself. My secretary doesn't have to do it because I know how. And for the doctors in the audience, I'll be paid in less than 2 weeks. Finally, our outcomes are very comparable, if not better, to the U.S. system. The cancer care scare that I've heard mentioned, that 30% higher death rate in Canada and elsewhere due to cancer, is just not true. And I don't have the references for you here and now, but if you look that up, you'll realize that's not true. Some of the things that are done that people demand are dangerous. All these radiation studies are dangerous, and there's often no need for it. Here people go to their family doctors. They're referred to people like me. There is gatekeeping in that sense, but you can go to any family doctor you like, and they can refer you to any specialist they like. And we will do what seems to be best. We will not put you through studies that might be risky and that are unnecessary in order to make money. And for an example, in heart care, our patients do as well or better. That's a published fact. And we may not do surgery for one artery disease, but that makes it better for later on. Because if you have to go back, there's no scar tissue to get through. That sounds rather specialized and complex, but a lot of things are done unnecessarily for money and also for avoidance of litigation. And because patients are told, you need this, by the media. I would like to have been able to go back to the U.S. I might have liked to be able to go back to the U.S. as a senior. But until there's a medical system in which everybody is treated, I'm concerned for everybody else as well as myself, but I don't want to be there at age 85 and go bankrupt because I'm ill. And right now, I don't want to be micromanaged by a non-medical person who has other fish to fry, that is profit. So I'm very happy working in Canada, covering everybody, practicing medicine the way my peers advise, the literature, the best evidence. Thank you for your attention.